Test the range of motion by having the patient lift both arms in an outward circular motion until they are directly above the head. Then bring them down in a forward arc, passing midline and extending the hands beyond the buttocks.
Around to your back and cross them behind you.
Have the patient relax her arms, then cross them at the wrist behind her back. Then place both hands on the back of her head with her elbows out to the side. Note any limitations in her range of motion. Further assess flexion of the elbow by having the patient hold her right hand at her side and raise it from the elbow until her hand is tight against her shoulder. Repeat with the left. With her hands held in front with the elbows bent to 90 degrees, ask the patient to pronate and supinate her hands, then tighten and relax her fists. Note any hesitations, facial grimacing, unequal movement of one side, or inability to perform. Now palpate the joints of the wrist and the digits. Be alert to excessive size and tenderness. Test arm strength by asking the patient to resist first your attempt to pull her bent arm out straight, then pushing your hand away.
Come on, straighten it up. Straighten, 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 straighten. That's a little bit.
Have the patient lie down for the next portion of the assessment.
There's no abnormalities.
Inspect the feet for overall shape and toe configuration. Note corns, calluses, swelling, nodules, and deformities such as bunions and hammer toes.
There does not appear to be any swelling.
Support the foot in your hands and palpate the anterior ankle with your thumbs, then the Achilles tendon with your fingertips. Joint spaces should be smooth, with no swelling or tenderness. The tendon should be firm and pain-free. Check ankle flexion by supporting the foot with one hand beneath the ankle, and with the other press the foot upward, then gently rocking the ankle inward and outward. Palpate the metatarsophalangeal joints with your thumb on the dorsum and your fingers on the plantar surface of the foot for any swelling, tenderness, or nodules. Palpate along the base of the toes at the ball of the foot.
There's no abnormalities that I can feel.
Finally, using your thumb and forefinger, palpate the joints of each toe. Repeat the exam for the other foot. Now palpate the hip joints, paying particular attention to swelling or tenderness in the area of the greater trochanter, the ischial tuberosity, and the anterior superior iliac spine. This portion of the exam may not be possible if the patient is significantly overweight. The patient can demonstrate active range of motion while lying down. The movements are done first on one side, then the other. Those to be requested are as follows. Foot dorsiflexion, foot plantar flexion, foot eversion,
I'd like you to roll your foot out.
Foot inversion,
Roll your foot in. Okay.
hip flexion with the knee straight,
Absolutely. Okay.
hip flexion with the knee flexed,
And now I want you to put your entire leg
external rotation at the hip,
rotation is what it's called. Roll your leg in.
internal rotation at the hip,
Outward.
and hip abduction and adduction. These are best done with the legs well apart at the beginning of the exercise to allow room for adduction without crossing the legs.
Past the midline at all? Very nice. Okay.